Right. Good afternoon, everybody. This is Mayur Natarajan here. Today I have with me Dr. Rajiv Lochan, who is the lead consultant for Integrated Liver Care Team at Aster RD Hospital. Without further ado, I would want doctor to start his session. The session is about liver transplantation, and let us hear out from the doctor what he has to say about it.
Thanks, Mayur. It's really a pleasure to interact with you all through this digital platform. So I'm all yours for any questions you might have. I think we have a series of questions on transplant and its affordability.
Yes,
pediatric liver transplant. These are the three important things that we cover.
Correct, sir. So I'll just begin my question in clusters. I just want you to give us a walkthrough on what is liver transplant and what are its types.
Okay.
And I'll follow it up with other questions.
Okay. So essentially, liver transplant is of two types. The first thing to say before that is to say that a transplant becomes necessary in a small number of people with liver illnesses when the liver has lost its capacity to regenerate. The liver is a wonderful organ. It's the only organ in the adult body which can regenerate, and there's a lot of reserve. But when this reserve is overcome, and when the liver fails completely and the body is not able to sustain day-to-day activities, that is when a transplant is needed. So this obviously has to be assessed in a team as to whether a patient needs a transplant or not. That itself is a completely intricate and complex process where lots of people are involved. We'll not touch on that. We'll talk about it at a later date maybe. So as far as transplants are concerned, there are two major groups or types of transplant depending upon where we get the liver graft from. Because for a transplant, the most important thing is that we have a viable liver graft, and there is no other human machine or medicine made which can replace liver function. Now that's another topic for another discussion on another day maybe, to talk about liver dialysis and stem cells and liver replacement therapy. But as of now, we need a liver, and the human liver is available from two sources, a human liver graft. The first one is a living donor liver transplant, where a living person donates a part of the liver, half or 1/3 or 2/3. We can donate up to, a living person can donate up to 60, 65, 70% of their liver mass. This they can do because, as we talked about earlier, the liver can regenerate. Okay, so this is called a living donor liver transplant. The other type is when a deceased person, a person who is brain dead, is in the ICU and the organs are kept viable. Remember, I am not using the word alive. The patient is dead, but the organs are kept viable by life support devices. Such a person's family donates their loved one's organs, and this is called a deceased donor liver transplant. This liver again can be used either fully or it can be divided into two. This is called a split liver transplant, and we'll talk about that maybe later. So this is another source of liver. So deceased donor transplant and living donor liver transplant.
Thank you, sir. So we clearly understood the two sources of liver transplant. Sir, is there any age limit for liver transplant?
Not really. Children as young as a few days have undergone transplant, but generally we don't transplant till people more than 70 years of age unless they are really, really fit.
Okay. So there is no lower limit to the transplant, but there is a higher limit because we have to see their age and
make sure that they're fit enough.
Okay.
So we need to measure up the risk of the transplant versus the benefit.
Okay, fair enough, sir. So that the lower age limit brings me to another question. What are the common reasons for children having to undergo liver transplants, and what makes pediatric liver transplant special?
So this is there's a topic very close to my heart, and pediatric liver transplant is one of my main interests and also the interest of all the doctors in our group, and we do have a good pediatric practice going here. So children's liver diseases are very, very fascinating. In adults, the causes of liver disease are different, and the cause in children are different. So when we talk about pediatric liver transplant, we generally talk of transplants in individuals less than 16 years of age. Now, the causes of liver disease in slightly older children, adolescent children, are different, and causes of liver disease in children less than 5-6 years of age are different. Okay. So one of the most important causes of liver disease in children is actually a disease called biliary atresia, where the bile ducts don't develop. Okay. Another important large group is all these metabolic diseases, like for example, diseases which occur because of metabolic problems, and these are actually storage diseases, like within storage diseases like polysaccharidosis, and Wilson's disease, which is a disease of copper metabolism where copper accumulates. Then there are other very rare metabolic illnesses where specific amino acid deficiencies can cause a serious problem and cause accumulation of ammonia in the body. Okay, so this is another large group. And in older children, children can develop fatty liver disease. This is a very important cause in older children. Then there are tumors for which we transplant as well. Some of our viewers might be surprised to know. So there are rare tumors of the liver which is called hepatoblastomas, and very rarely vascular liver tumors. So these also need a transplant. Okay, so broadly we have metabolic diseases and biliary atresia, and also Wilson's disease, which are the common causes of pediatric transplant. Now there is another question which you asked about what makes them different. It is because of these very rare causes, and you have to really be alert to picking up the fact that the illness in a child is because of a liver problem. See, a child might present with seizure, inability to thrive, and the underlying cause might actually be a liver problem. So there is a separate subspecialty in pediatrics now, which is called pediatric hepatology. And a lot of children presenting to the pediatric intensive care units might have an underlying, metabolic problem, and the root cause of the metabolic problem will lie in the liver actually, and changing the liver and doing a liver transplant will actually solve that problem. And the other reason what makes pediatric transplants interesting is because they are highly technically demanding surgeries, and the children are really small, and you need to work really closely with the pediatric intensive care people, surgeons, hepatologists, to actually take a very small child who weighs 5 kg, 10 kg, 15 kg through a transplant. So it is not only the operation that is technically demanding, but following operation, treating the child in an ICU, and looking after them, is actually, a big challenge.
Okay, sir. Thank you so much for that. I have a couple of questions related to this before I get into the next segment, which is affordability of liver transplant. One is, what is the success rate of pediatric liver transplant? Because children are very young, right? So it must be a difficult thing. And the other is, how long with the new liver a patient can survive?
Okay. So these are very important questions. Obviously, we measure, anything is measured by how successful it is, isn't it? So what I'd like to draw attention of you all is that the first transplants were done for actually small children. So there's a guy called Thomas Starzl, and there is a really wonderful book called The Puzzle People. So viewers who are interested should actually look it up. It's available on Amazon just for like 200 rupees. It tells the story of liver transplant, of how liver transplantation developed and came about, and more. This guy called Thomas Starzl and his team did transplants in children. So some of the first children who were transplanted in the early 80s are still alive today. They're all grandmothers, and they've had, children, and their children have grown up, Obviously, pediatric liver transplant is very successful. That's the reason why they're all alive today, quite a large number of them. Of course, as decades have passed, children being transplanted in the new millennium are actually doing much better than the children transplanted during 1990s. This is because of improvement in intensive care, improvement in perioperative care, looking after children during the transplant, after the transplant, and development in medicines. So newer medicines are available now which have lesser side effects. So it is now common practice to talk about pediatric transplant survival in 10 years or 20-year terms. We don't really talk about how many children will survive at the end of 1 year. We talk about making life better for children at the end of 10 or 20 years. So children can grow up into becoming adults, and also grow up to becoming parents, and also grandmothers. So, and this is only likely, the results are only likely to get better in the future. We certainly in our group, we have children who we transplanted 7-8 years ago. I remember a particular young boy who we transplanted when he was a small child. He wasn't even going to school. He is now, about to go into high school. There's another girl who's about to go into college. Another young girl who we transplanted just from Hassan, we transplanted just a few years ago. She secured one of the highest marks in her taluk. I don't want to name her here, on a public platform, but it had come out in the papers and everything. So she's now about to go into college. So in our own group, our 1 year survival for pediatric transplants is more than 94%. So we have done close to 100 pediatric transplants over the past 4 years, and more than 94% of our children are alive.
That's a big number, 94%. Brings me to our next question is, who can be a donor? And where do we find these donors from?
You mean living donor?
Yeah. Yes.
Yeah. So generally the law prescribes two types of donors. One is a close family member, which is near relative, and the other one is a non-near relative who is still close to the family but are not first degree relatives. Generally, as far as pediatric transplant goes, what we have seen in our practice is that parents are usual donors. Either the mother or the father are the usual donors. Sometimes you can have uncles or aunts or grandmothers as well. We had a twin transplant that we did in our Cochin hospital. Two children presented with rat poisoning within a few hours of one another. They accidentally ingested something at home. They were around about 2.5 years old, both of them. They were twins. The mother donated for one twin, and the mother's mother, the grandmother, donated for the other twin. So usually near relatives donate a small portion of the blood.
And can a donor lead a normal life once he's donated the liver?
Absolutely. Especially as far as pediatric transplants are concerned, you see, we only take a very small portion, around about 150-200 grams, and we take the left side of the liver. The donor is back doing normal activities within 10 days, and some of our donors have gone on to have another child as well. A few years afterwards. Some donors have gone on to get married, when they were unmarried, they've gone on to live normal lives. One of our donors is actually a farmer leading a very active life. Lots of our donors have gone into becoming engineers, and some have migrated abroad. So you can lead a normal life. However, there is a very small risk during the time of the operation that the donor surgeon will sit and discuss with the individual donor. There is a very, very rigorous process of evaluation of the donor to make sure that the risk which they have because of the big operation that they are undergoing is brought down to as close to zero as possible.
Okay, thank you, doctor, for answering all these wonderful questions. Now let us get to the final segment, which is the cost of liver transplant and the affordable liver transplant program, which I want doctor to speak on. So, can you tell us what would be a normal cost of a normal liver transplant, not specifically pediatric?
Okay, so let us talk about how we do it in our hospital. Obviously, cost is a very, very important thing. There is only one government institute which does transplants, which is in Delhi, and there also the cost, is kind of flexible. We are not really aware of the exact numbers there, but in our hospital, the living donor liver transplant cost varies from 18 to 20 lakhs. So this is the normal number. And obviously, if a patient is more ill or needs more intensive treatment during or after the operation, the cost will go up a little bit. Now, pediatric transplants cost 15 lakhs. That is the cost in our hospital. Obviously, even 15 lakhs is actually a very, very large number, and for average people. There are various ways in which we can work to actually try and help the families to actually pay for this cost.
Nice. So doctor talked about helping families to pay for this cost. Let us try to understand what this program that, in fact, we mentioned at the start, affordable liver transplantation program. So can you throw some light on that?
Okay, so let me tell you how it all began. So we all came back to India 7 years ago with the hope that we'll be able to make a difference to healthcare in India. And so when we, 4 members of the integrated liver care group, we started off in 2013. We were only 4. Now we are 12 people, and we work in all of the Aster hospitals, and I'm based at Aster RV. So the way we do this is, it's very simple. Children are our future. Now, and number one. Number two, and they develop liver diseases for no fault of their own. So generally speaking, just to be very candid about it, if you talk about liver disease in an adult, the immediate reflection is to think that it's alcohol which has caused the disease. Whereas that's not really true. It's only 1/3 of adults with alcohol who develop liver disease. Then the other causes as well. In children, that stigma is not there. And number one. And number two, they develop disease for no fault of their own. And like I mentioned earlier, they are the future of our country. And see, they could be the next Abdul Kalam Azad, or they could be the next Vikram Sarabhai, or they could be the person who's treating me when I'm ill, me and you are ill, when we are old. So we owe it to children for the future to actually help them. And this was the idea that we started off with. That is number one. On the other side, we are all into very specialized, aspect of healthcare. We do liver-related treatments, and these treatments are costly. They are not generally available in the public hospitals, and we work in a private hospital. So these are the two sides of the story. How are we going to balance this? So we came up with a model. We thought that, people would only buy into this idea if everybody who is involved had a stake in it, right? So we as doctors, we have a stake. The hospital which provides healthcare treatment has a stake. The patient, they have a stake. And society too has a stake, because children are going to grow up and become a part of society. So we thought that we will distribute the cost of this liver transplant amongst these 4 stakeholders. So it is very simple. So we decided, let's say the cost is 15 lakhs. Yeah, we talked about pediatric liver transplant costing 15 lakhs. In that 15 lakhs, we put our stake in. The doctors, we have a stake, because we are operating, we like to do these operations, we like to get them better. So we have a role to play. So we thought that we will reduce our cost. So 2.5 lakhs we take out from this 15 lakhs, which is the professional fee of the doctors. So 15 lakhs becomes 12.5 immediately. Okay. Now the hospital also plays a role, because it puts in subsidized medicines and reduces the cost. Okay. So we have, from 15 it's become 12.5 already. Yeah. Now out of this 12.5, the family, because the family has a stake, because their loved child needs to be treated. So they put in 2.5 to 5 lakhs, depending upon how much they can put in. So from 12.5, we have already come down to 7.5. So 7.5, we approach society, because this child is going to grow big and hopefully contribute to society. So and nowadays, how do we ask society? We go through crowdfunding. Okay. And the other thing we ask society is, we ask all these big companies, through CSR, so that they can put in that 7.5. So this is how we come up to that 15 lakh number. But the family actually pays 2.5 to 5 lakhs, depending upon the financial capability of the family. So the cost of the transplant is still 12.5 lakhs. But, 15 lakhs. The cost is 15 lakhs. But the family pays 2.5 to 5. So as far as the family is concerned, they are only paying 2.5 to 5 for a liver transplant for the child. And this is the formula we have used. We have treated close to 94, 95 such children over the past 4 years. And in fact, I just now had a call from one of the other districts, here in Bangalore, for a child who needs such treatment. And with this, we've had, we hope to continue to do better. Hopefully, our aim is that any child who needs liver-specific treatment, it could either be surgery or transplant, is given an opportunity, at least as far as the liver is concerned, to undergo this treatment.
Thank you, sir. Sir, I have one more question related to this. I'm not sure how relevant it is, but I would like to ask you anyhow.
Yeah.
Sir, so you mentioned about approaching the societies, you yourself contributing something, hospital subsidizing, and then of course the family giving whatever they can.
Yeah.
For a pediatric liver transplant.
Yeah.
How do you decide that which family needs how much? Is there a criteria that you have?
Yes, this is I think the most important question. See, I mean, just to be very frank about this. See, whenever something is available for less, everybody wants to have it, isn't it? So, but you can't give it out to everybody. You need to make sure that the family kind of measures up to a certain economic status, because somebody who can really afford the 15 lakhs, they should pay for the 15. Yeah. So what we have said is that anybody who has a BPL card, or and then we look at their bank statements. If the family earnings is more than 5 lakhs, then we really don't offer this treatment to them. However, we should be, we are flexible with this. We have a little social worker in our group, and we also have a little small group of people, within the hospital administration and us doctors who really assess the patient and their family. Because even for people who earn more than 5 lakhs, which is like 50,000 rupees per month, even if they're earning 50,000 rupees per month, suddenly to cough up 12 or 15 lakhs becomes too much. So when they are earning more than 5, we scrutinize them very, very carefully. And we really make sure through personal interviews by ourselves and also through our social worker, who is a part of our team, we ascertain and make sure that this family really deserves this affordable liver transplant program. And by looking through, we ask them to submit bank statements and their income tax returns if they are filing income taxes, and depending upon that, we take a call.
So that was really wonderful, doctor. So to summarize what doctor said of this program, yes, everybody is eligible for this, this kind of a sponsorship. But definitely, if you are deserving and actually are genuine, then only we go ahead with this, which is a very good thing, because not everybody needs that kind of support. People who actually need are given that support.
I mean, just to say, out of the 94 children, 3 of our children were actually fully paid transplants, and one of them actually has supported another child as well to undergo this affordable liver transplant treatment. But I must say that the vast majority of children who come to us are referred from the from other hospitals, and they really can't afford this treatment.
Thank you so much, sir, for enlightening us on this. And with this, we come to the end of the Facebook Live program on liver transplantation with Dr. Rajiv Lochan. It was a pleasure having you, sir, and we look forward to more sessions with you. And until the next health program, this is Mayur signing off. Thank you so much. Have a good day.